Okay, just a quick review of the various dermal receptors. Now there's a different video that has all the dermal receptors in there. These dermal receptors include things like the free nerve endings, Krause's inbulbs, Messner corpuscles, Pacinian corpuscles, Ruffini endings, root hair plexes. All of these receptors here are going to either provide tactile information, pressure information, or sensation of temperature difference between the body and the external environment. Let's take a look at the various types of proprioceptive signals that we're going to get. Proprioceptors are going to be predominantly muscle spindles, tendon organs, and then joint receptors. There's a combination of fast adapters and slow adapters. They're going to allow us to be able to discriminate tension and compression within the muscle and within the surrounding ligaments and tendons of the articulations, so that we're able to figure out where exactly in space our limbs happen to be without having to look specifically at the limbs. So first off is the muscle spindle. So the muscle spindle is comprised of two parts. There's what's referred to as the intrafusal and then the extrafusal part. These are interspersed within the muscle themselves, and they basically integrate themselves within the skeletal muscle tissue. They're going to consist of two distinct receptors, which are referred to as the interfusal fibers. The interfusal fibers are made up of two parts. We have what's referred to as the chain group and the bag group. What they do is that they set the amount of tension necessary for a contraction to take place. These are going to regulate how strong a contraction takes place. It also sets the rate at which tension gets developed within the muscle. It has two distinct fibers that are coming to the muscle spindle, and then two distinct fibers heading away from the muscle spindle. There are what are referred to as type 1 and type 2 afferents, and then what are referred to as the alpha motor neuron and the gamma motor neuron. Gamma motor neurons set the tension within the muscle spindle. Alpha motor neurons cause the skeletal muscle itself to contract, the extrafusal muscle itself. Based off of where we set the tension within the muscle spindle, we will contract to that specific distance. When we talk about muscle learning and motor memory, what we're actually talking about is we're talking about the ability to set the muscle spindle to the correct tension in order to produce the movement that we desire. This is also going to be the receptor that's going to fire if the muscle happens to be overstretched, causing the muscle on the antagonistic side to relax and the agonistic side to contract. This is part of the receptor group that gets fired when we happen to do the stretch, the tendon jerk, or the tendon stretch reflex. So here is the actual muscle spindle itself. So notice we have distinct areas to it. We have the extrafusal part, which is the actual skeletal muscle itself. And then we have the intrafusal part. The intrafusal part is made up of two distinct tissues. We have neural tissue, the receptor endings, and then we have muscle tissue, what are referred to as the intrafusal fiber tissue. What ends up happening is we have two distinct types of receptors, the chains and then the bags. And if you notice, what ends up happening is coming away from the type 1 receptors. We have a muscle spindle that will contract so that it bulges like we would see within a normal contraction to a set level. And based on the surrounding tension to the muscle, the type 1 fibers will either be stretched or relaxed in terms of the tension that are placed on it, causing the actual mechanoreceptors to open or close. The type 2 fibers are stuck within what's referred to as the chain fibers. These chain fibers are going to sense the amount of stretch being placed on the muscle, not the amount of compressive tension being placed on the muscle. What these fibers are going to do is they're going to fire based off of how stretched the capsule within the muscle spindle happens to be, sending back a relay signal as to whether or not we actually have to start the contraction. Whereas the type 1 fiber is going to send back a signal saying that we have the correct amount of tension that has been generated to control the contraction. So what we're doing with the type 1 and type 2 fibers is that we're analyzing the amount of tension that is there and then the rate at which the tension is being developed so that we have the correct amount of contractile force, tension, strength within the muscle to do the activity that we want to do. These muscle spindles work hand in hand with the tendon organs, or the GTOs. The GTOs, or the Golgi tendon organs, are utilizing type 1 afferents. It's a slightly different type 1 afferent than what we saw with the muscle spindle, that get embedded within the elastin and the collagen fibers of the tendon. What these do is just like with the chain fibers. What they do is they sense how much tension, how much stretch is being placed across the serial connective tissue patterns within the tendon. And what it does is it will send an inhibitory signal to the antagonistic muscle if the tension becomes too much. This type of receptor is going to ensure that there is not so much tension across the tendon that the tendon can tear or rupture. The last type of proprioceptive responder that we get is what's referred to as the kinesthetic receptor, or the joint receptor. In the joint receptor, we have three distinct types of receptors. We have receptors that are going to respond to tension. We have receptors that are going to respond to pressure and distortion. And then we have receptors that are going to respond to pain. These are all embedded within the synovial joints, within the capsular region of the synovial joints. And what they're going to do is they're going to send signals about where the joint happens to be in space, in which the Ruffini endings are very fast adapters. What they're going to do is they're going to distinguish what is the rate of change of tension based on where the joint is in space. The Pacinian corpuscles are going to be very slow adapters. What they're doing is they're measuring how much pressure is being placed onto the joint within the joint capsule. The nociceptors are going to be found within the epiphyseal region of the bones during the articulation, forming the articulation. And what they're going to do is that they're going to measure any distortion happening on the articulating surface that may lead to tissue damage. What the Ruffini endings allow me to do is allows me to figure out how quickly am I changing my arm position as I try to abduct to 90 degrees. The Pacinian corpuscle is going to fire telling me that I'm at a certain degree. So if I set the muscle spindle to be at a 90-degree abducted position, the Pacinian corpuscle and the Ruffini endings are going to change that contraction level based off of the rate of change and the relative position that I need to get in order to be at that 90 degrees of abduction within the deltoid muscle that's causing the abduction to take place. The last thing we have to look at is reflexes. Reflexes are automatic, sudden, involuntary responses to stimulus. We cannot cognitively control the reflex. We can cognitively modify the reflex, cause the reflex to become accentuated or inhibited, but we cannot actually cause the reflex to take place cognitively. We're going to look at three distinct types of reflexes, and then a special type of reflex that is really nothing more than a withdrawal reflex. The first one is referred to as the monosynaptic reflex. The second one is referred to as a stretch reflex reciprocal inhibition. This is the tendon jerk reflex. Then we get the withdrawal reflex and a special type of withdrawal reflex known as the cross extensor. Now, when we talk about reflexes, we talk about them based off of being synaptic, in which we have a monosynaptic, a disynaptic, and a polysynaptic. What we're really talking about is how many interneurons are involved in the pathway. So even though we call something a monosynaptic, it really has more than just one synapse. It just happens to usually have one interneuron in between the afferent sensory neuron and the efferent motor neuron. So the first one we're going to look at is the monosynaptic one interneuron reflex, where we get the sensory input from the dermis and from the epidermis, indicating that, hey, you stepped on a tack dummy. That signal is going to head to the spinal cord. Now, we don't have to cognitively think about the fact that I stepped on a tack. This is what happens in the middle of the night when the kids leave the Legos on the floor and you step on the Lego. You never actually realize it's a Lego. You simply do the response, the effective response. The synapse goes to the interneuron. The interneuron will then synapse onto the lower motor neuron, which will then send a signal via the efferent pathway out to the effector, causing the response. All of this takes place before you can even think about having the response to the stimulus. Now we're going to look at the excitation reciprocal inhibition, or the tendon jerk reflex. So what we've done is we take the reflex hammer and we strike, say, the patella tendon. The patella tendon triggers the GTO and it triggers the muscle spindle to become activated. The GTO muscle spindle combine to send an afferent signal. This afferent signal will then synapse on at least 2, if not more, synapses within the spinal cord. This will then send 2 distinct signals. To the antagonistic group, in this case here, the hamstrings, it's going to send a signal that says relax. It inhibits contraction. To the quadriceps muscles, it sends a signal of contraction, activation, excitation to cause the tibia to swing anteriorly and superiorly so as to relieve the tension on the GTO and the muscle spindle. The swing is only big enough to relieve the positive tension placed on the receptors. It is not an exaggerated kick forward. It is a small little swing. Some reflexes on this may not actually elicit a full response. However, if we put electromyographic recorders onto the muscle, we can actually see the electrical signal from the muscle being activated if we don't happen to strike at exactly the correct spot or with exactly the correct amount of force of impact to elicit the reflex. So the next one is what's referred to as the withdrawal reflex. What the withdrawal reflex does is it, based off of sensory information, it initiates a triple flexion. That is flexion at all of the distal regions of the kinematic chain. So in this case here, we're looking at, say, a child reaching up to the stove and touching the hot stove. This sends a signal along the afferent to the spinal cord, at which point in time, via the spinal thalamic tract, it's going to synapse immediately onto the efferent, which is going to cause contraction on anything that flexes. So it's going to cause flexion at the wrist, flexion at the digits, flexion at the elbow, and possibly flexion at the shoulder, depending upon the amount of stimulus that happens to be there. In order to get those flexions, we have to inhibit the extensors, and so it inhibits all of the extensors within that extremity. At the same time, it's going to send a signal to ascend to the brain, hopefully so that we learn not to do this again. So if you notice, here's another withdrawal. But the problem is the withdrawal in the lower extremity. You may notice that there could possibly be a problem if we happen to withdraw the lower extremity in a standing position, which is where we get what's referred to as the crossover withdrawal. What the crossover withdrawal does is allows me to catch myself on the opposite limb. So I step on the Lego at night. I immediately withdraw the foot that struck the Lego. So that I don't fall down, I have to extend the opposite limb, hopefully not to put the opposite limb, the foot, onto another Lego, because then I'm going to have nothing to stand on because both feet have just impaled themselves on Legos. This crossover withdrawal leads to a pattern of motion known as a central pattern generated motion that allows me to do things like walk, in which, as I strike the ground, I undergo a withdrawal, which causes a extension on the opposite limb. As I strike the ground, it causes a withdrawal, which causes a extension on the opposite limb, and I learn how to walk through a crossover withdrawal reflex. This crossover withdrawal reflex is what allows us to maintain a stable two-footed stance at all times while moving through the environment.